So a few minutes ago I was thinking about this time last year, last July, when many of us were gathering here and we were having press conferences and talking about the situation that we were facing here at the medical center with lots of sick patients, lots of COVID patients, and uncertainties, about how to best take care of these patients, how to treat the patients, the stresses that our nurses and physicians and all of our caregivers were experiencing. And we've come a long way since then. We have come a long way since then. I would have hoped, if you had asked me then, would we be beyond this pandemic now? I certainly would have hoped that a year later we would be beyond it. We've come a long way. We now have options and we know things that we didn't know then, but yet we are still having to deal with the pandemic throughout this time. And now it's been a year and a half and we don't know what the next year and a half holds. But throughout this time, the medical center has felt a responsibility and an obligation as the only academic medical center in the state, the place that takes care of the sickest patients, whether we are talking about tiny newborn babies or older adults, immunocompromised patients, whatever the case may be, trauma patients. We take care of the sickest patients in the state, and we are proud of that. And that is a responsibility that we hold dear and that we take very seriously. From the beginning of this pandemic, we have pledged to all of you, to our employees, to the patients, to the citizens of Mississippi, that we would bring all of our resources to bear and that we would take that leadership role and try to set the example for others in healthcare across the state. So, as you have heard, yesterday we made an announcement about a new policy. So the new policy, now going into effect, will require all employees, all students, to either be vaccinated or to wear an N95 mask. So again, this time last year we were just hopeful for the vaccine. We didn't have the vaccine yet, but we were hopeful for a vaccine as something that could be a defense mechanism, something that could be a tool to manage this pandemic. And in fact, now that vaccine is available. Mississippi's rate of vaccine uptake is not what we want it to be. It is not what we need it to be. I saw yesterday, I think it was, or in the last day or two, that we did indeed pass the 1 million citizen number of being vaccinated, but that's about a third of our state. And we have a state of people who have health challenges. You think about where we are as a state, looking at some of those chronic diseases such as diabetes, hypertension, all of those things. And we have a significant portion of our citizens in the state of Mississippi that have what we call comorbid diseases, diabetes, hypertension, heart disease. And we know that those patients have a higher risk of a poor outcome with COVID. So what we have begun to see is an increase in the numbers. Just like in a lot of other states, we're seeing the numbers tick up. We're seeing the numbers of new cases tick up. We're seeing the numbers of cases that we have here at the medical center ticking up, the numbers of hospitalizations and ICU patients across the state. I know that you have heard all about the Delta variant and how it is viewed to be more contagious than the original virus that we were dealing with. So for all of these reasons, but at the very, very heart of it, the number one reason being that we take care of the sickest patients in Mississippi, we feel strongly that this is the right thing to do. Myself, Dr. Alan Jones, Dr. Jonathan Wilson, the team that has led this pandemic fight from the beginning, The three of us, along with many others, have thought about this carefully for the last weeks, last month, even more than a month, and really tried to think through what is the right thing to do for the safety of our patients, for the safety of our patients' families, for the safety of our employees and our own families. We feel that this is the right thing to do. The vaccine has been proven safe. It has been proven effective. More than 90% of the patients that we are seeing right now that are very sick are unvaccinated. So we know it is a powerful tool. We didn't have this tool available this time last year. You think about a year ago, and now we've got something that is effective. And we need to use the tool that we have. I acknowledge, and this is not a surprise to any of you, not a surprise to any of us, I acknowledge that this is not a popular decision with some people. There are some people in the medical profession who, in fact, this is not a popular decision. And I acknowledge that. But on balance, when I think about the responsibility that we have to our patients who are very vulnerable and very sick, I feel strongly that this is the right thing to do. I'm going to ask Dr. Jones to come to the podium and to make comments.
Good morning, everyone. As Dr. Woodward has mentioned, we've become one of many healthcare institutions that have announced a vaccination policy. While we may be the first in Mississippi that has done that, we're certainly not the first across the country. Many academic medical centers and other healthcare institutions have created policies similar to the one that we have created. I want to emphasize a few things about ours. The first is that recognizing that the vaccines that currently we have available are still under an emergency use authorization, we are offering employees a choice of whether they either receive the vaccine, the full series of the vaccine, or they wear the best protection in terms of a mask that we can offer to our patients, and that is a filtering N95 mask. They will be required to wear that mask at all times when on UMMC premises. If you're fully vaccinated, we believe that the
Put a couple of these up here for visibility.
we believe that the effectiveness of the vaccine, the data behind it, is so strong that we can confidently allow vaccinated individuals in non-clinical areas to go maskless, similar to what you're seeing in the community with CDC recommendations. So fully vaccinated employees in non-clinical areas will be allowed to go maskless. Unvaccinated individuals will be required to wear an N95 mask at all times. All of our employees that work in clinical settings, direct patient care settings, will still be required to wear a mask. Some will have on N95s, some will have on a mask of choice, such as a surgical face mask. We believe that this introduces the two methodologies that allow us to decrease the spread of COVID to the maximum amount that we can. We know that the most effective way to decrease the spread is through vaccine. The second is through a filtering mask. That is in alignment with the CDC guidelines. So we feel strongly that these two things offer an environment to our patients and their families when they come into our healthcare setting, that they can feel confident that we've done everything as a healthcare organization that we can do to provide the safest environment for them, for the patients and their families. We recognize that this is not necessarily going to be, everybody's favorite decision that we've made. But we, as healthcare providers and as a leading institution in the state, believe we have an extraordinary ethical responsibility beyond a personal choice responsibility to make this decision and lead. And we hope, while we don't know, but we hope that other hospitals and healthcare organizations in the state will follow our lead. Our decision to do this has really been emphasized by when we wake up every morning and we look at our counts. Our counts are rising daily. We're at the highest point now than we have been in months. Doubled in the last week in our inpatient census. We've got more pediatric patients in the hospital than probably we've had through the pandemic, COVID pediatric patients. So that just emphasizes to us that we really have to take a strong stand for our patients, for the state, and be a leader in this. There's a lot of myths out there about this vaccine. There's a lot of people that believe that there's too much uncertainty. One of the things that we're hearing pretty intensely is regarding younger women, particularly childbearing age women, and how this may affect fertility. We're hearing that the N95 masks are not what people would want to wear, and we've worn different masks through this. All of those things we can back up. We've thought about carefully, and we believe, a firm evidence base behind what we're recommending. This vaccine there's zero evidence that there's any effect on fertility. There's zero evidence that it has any effect at all on pregnancy and pregnancy outcomes. We have strong evidence that a filtering mask is much better at decreasing the spread of an airborne disease like COVID than a regular mask. So we've thought about this very, very carefully, and we believe that we're offering our employees a choice, and that choice will provide the environment that we want to provide for our patients.
Questions? So both Pfizer and Moderna have applied for full FDA approval of their vaccines. That should go into effect before your policy of getting the vaccine wearing a mask goes into effect. If the vaccines are fully approved, which all experts believe they will be, will that choice between a mask and a vaccine become just get the vaccine?
That's a good question. So, yes, both have applied. We're not sure the timeline of when the full FDA approval will be granted. In the policy, we created a provision for several things. The first is that if a booster shot becomes recommended by the FDA, that will be required to be fully vaccinated and continue to not have to wear the N95 mask. If and when the emergency authorization use is lifted and the FDA authorizes full authorization for the vaccine, it will then become a condition of employment or enrollment in one of our schools.
Will there be a verification process for individuals to prove that they've been vaccinated? Will they have to present a vaccine card, or will it be based on the honor system?
So we do have a process. There are multiple ways that one of our employees could be verified. They could present information to us, such as a card. We have the ability, with their authorization, to search the electronic database through the Department of Health. So, that is protected health information, so we have to get authorization to do that. But we're trying to make this as seamless and easy on our employees as we can.
And about 50% of our employees were vaccinated with us. It may be a little bit more than that, but in that range. And we know, though, that some probably got vaccinated at their own physician's office, at Walgreens, whatever, CVS. So we have designed a process that no matter where they got vaccinated outside of the medical center, we can validate that that has occurred.
So a lot of people are wondering if long-term care facilities will start following the lead set here by UMMC. Will they have the ability to use the same authorization process as you guys are using to search the state database rather than using the honor system?
I would assume so. I believe that healthcare organizations can apply and be granted access to that database. Of course, they have to have the authorization of the patients in place, but that might be a question for Dr. Dobbs or somebody at the health department, but I would assume that to be the case.
And have you anticipated any legal challenges to this policy? I mean, what do you expect the reaction to be?
So we know that it will be a mixed reaction. Like I said earlier, we acknowledge that this is not going to be a popular decision with all of our employees. And the last thing that we want to do is to lose employees over this. The last thing we want to do is have employees leave us and feel, angry at us about this. I've talked to you before about our challenge in getting in the nurses that we need. I mean, we still have internally a nursing shortage in many of our clinical areas. So that to us is kind of the heaviest part of this, is knowing that some of our own will feel unhappy about this, but we do, at the end of the day, our obligation is to the patients. That is just the most critical thing. In leading up to this decision, we have looked at what's happened in other states, how other academic medical centers have done this, and we have had an intensive review by both our legal and HR teams to be sure that they feel the processes we are implementing through this policy are sound and defensible and are good.
Can you ballpark how many employees and students are affected by this?
So we've got around 10,000 employees and about 3,000 students. And as I said before, somewhere in the 50, maybe to 55% range, we know were vaccinated here when we had our vaccine blitz, back in the December, January timeframe. I'm certain that some have gotten vaccinated in other places, but if you guess that 10 to 15% received a vaccine somewhere else, we're still talking about a few thousand people that we are anticipating may be unvaccinated. And we hope that this will be the nudge that many of them needed, just to say, okay, now I'm gonna go ahead and do it. There's lots of information out there with our own internal memo that we released yesterday. And the VC notes that have come out today, we've got attached FAQs so that people, our employees and anybody else that has particular questions about the fertility piece or the other questions, we want, to the degree that we can, to answer people's questions and to arm them with information. But we do anticipate our unvaccinated employee pool could be 2 to 3, maybe even north of 3,000 people.
I did want to add one thing to that, just to emphasize, in trying to create a policy that captured the entirety of what occurs at UMC, in addition to students and employees, this applies to individuals that are contractors, vendors, affiliated students, any people that come into our walls that could potentially interact with our patients are affected by this policy. So it's a little bit broader in number than that. We can't give you an exact number, but it is a comprehensive policy.
Does that include visitors who are visiting?
I was just about to say, one of the questions that we have had is, okay, what about our visitors? Because right now visitors are required to wear masks. And at least for the foreseeable future, that will continue to be the plan, that visitors will be required to wear the mask. Even if there are visitors who understand what our current policy is and can say, I've been vaccinated, can I not wear my mask? We would not have the ability to validate that, and or even to manage the logistics. We have so many visitors. So for the foreseeable future, the visitor policy around mask use will not change.
You mentioned an increase in pediatric COVID cases and hospitalizations. Can you talk more about what you're seeing there? Do you have any cases of children in the ICU with COVID right now?
So we have seen an increase in pediatric hospitalizations. of COVID positive patients, higher than we'd seen in some of the previous peaks. We do have patients in the ICU today, actually more today than we had yesterday. So we are seeing a steady increase, although it's not the same size increase as adults, in terms of numeric value, but more pediatric patients than we are used to seeing, or that we have been used to seeing through the pandemic.
Even in previous peaks?
Yes.
Do you have any numbers or an estimate?
I can tell you that today we have 6 hospitalized patients. Half of them are in the ICU.
Pediatrics.
Yeah, pediatric patients.
And how many adult patients are hospitalized with COVID?
So in COVID positive and those that are under investigation, it would be 39.
Have you seen any resistance to the
So we put out a campus memo yesterday that contained the policy link. There was some activity on social media from my Twitter account, from the medical center's Twitter account, and on our Facebook page. And then, of course, we all have active email accounts here. So we have had some response and some feedback. And it's been mixed. So there's been some people that have emailed us or that have commented in some way on social media that are supportive of this and feel like it is the right thing to do. And then there have been some that are not happy about this at all, and they have expressed that. As far as the email goes, we've gotten some anonymous negative comments, but there have been some comments out there on social media as well. So, and we're not surprised. One of the things that we talked about internally was, before we put this out, okay, now we need to brace ourselves for hate mail, because we knew that this is an issue that, for whatever reason, people feel so strongly divided on, and it's so political, which is, just I struggle to understand that. When you send children to first grade, when people go to college, there's a list of vaccinations that are required. The concept of certain vaccines being required for your own safety and the safety of those around you, this is not new. This is a new vaccine, but the idea of requiring a vaccine for the public safety, for your own safety, is not a new concept. But there's a lot of charged emotions around this. And like I said, I have no doubt in my mind that this is the right thing to do, and this is the right thing to do for our patients. But the part that gives me a heavy heart about it is just knowing that some of our employees, who are so valued, people work here because they have a heart for the mission of this place. This is not a place to work if you're looking for somewhere easy, kind of a not too hard job. I mean, we take care of some sick patients here. So the people who work here have a heart for our mission and what we're doing, and we value them so much. And it is heavy on my own heart to know that some of our employees feel disenfranchised by this, because that's not the intent at all. But again, we kind of keep going back to, this is the right thing to do to take care of our patients.
You mentioned the fact that there is some resistance, some anonymous. Have you received any resistance or pushback from members of the legislature or members of state government? We have a governor who seems intent on promoting freedom, maskless freedom.
So we have not had pushback from members of the legislature or the state government. And in fact, I believe that our governor, our lieutenant governor, that our leaders are vaccine proponents. I mean, they have said in different public settings that they think the vaccine is important and that they encourage people to get the vaccine. So I feel that our state leaders are supportive of more people getting the vaccine, and for us as a state to have a higher uptake than we have had.
Can you walk us through the alternative? If someone is unvaccinated, they work at UMMC, they get infected, Have you seen that happen? And what is that look like?
So say that again. If they're unvaccinated and they work here,
If they're unvaccinated, they work, they get coronavirus, they come into work. How many times does that happen roughly?
You wanna speak to
What is happening?
yeah, we have had that occurrence. Yeah.
Yeah, so I am not prepared to give you specific numbers, although those events are things that we keep up with. Just because of the degree of transmissibility of the virus and the amount of activity that we have had through the pandemic, certainly we and other healthcare institutions have had events where we have employees, obviously before the vaccine, everybody was unvaccinated, who would unknowingly have coronavirus, either be asymptomatic or develop symptoms at work, and would pass that to other employees. I can't say for sure if we've had that happen where it's been passed to patients or not, but certainly within employee environments we've had that.
Students.
And students, we've had events with students where they've passed it to each other. Now, if you are unvaccinated and you get sick, you get a test. We treat you just like we did before the vaccine. If you get sick and you've been vaccinated, you get a test. We're still taking employees that are vaccinated out of work that are symptomatic and have tested positive, as we should. The vaccine is not 100% effective, so you can still get COVID, and you can still be transmissible to others. So we're treating the testing and isolation policies and procedures that we've had through this exactly the same. This is just an attempt to get more of our workforce vaccinated so that we can have a lower transmissible rate potentially to our patients.
Can you be clear about that? Studies have shown that getting the vaccine does reduce the transmissibility rate.
Yes, generally the patients, the people, employees or students that get coronavirus and have been vaccinated have a lower viral load, and it's not as contagious to others as if you're unvaccinated.
I'd like to talk a little bit about Delta briefly. As you've seen the surge of mostly Delta patients, as MSD has shared with us, have you noticed, obviously the transmissibility is increased, have you noticed more severe outcomes, some of the same patients having more severe experiences with the virus than with previous strains?
Short answer is no. Seems to be about the same. We'll say in the pediatric population, because we're seeing more volume, the patients that we are seeing that are positive and getting hospitalized are more than previously having classic COVID symptoms, whereas before we may have seen more minor, just runny noses or something very, very minor that those patients were testing positive. So that doesn't suggest that it's a more severe illness, but maybe just a more symptomatic in the pediatric population.
Is the hesitancy you're seeing, is it across the board, or is it in any particular areas of doctors, nurses, students, support staff? I know you only have data on the people that have been vaccinated here at this point.
And you specifically mean against the policy or
Just against vaccination?
the vaccination? I would say my general sense is, and we've not kept up with this, but and see what Dr. Woodward says, my general sense is it's just kind of across the board.
We along with so many different entities across the state, Dr. Dobbs, Dr. Anita Henderson with the AAP down in Hattiesburg, and the folks at State Medical, I mean, everybody has been trying to preach the same thing about the importance of vaccines, and to the degree that we can, we're trying to identify if there are pockets where the individuals have certain concerns. But it's really just a smattering. We have not been able to figure out a real rhyme or reason, but it's just a smattering of people from all walks of life, all types of occupations, all ages, that for whatever reason have a hesitancy.
We're going to wrap it up here in a minute, but I just want to make sure everybody's got the same numbers. So
As of this morning, our patient count of patients with COVID or with suspected, we had 45. 3 of those were awaiting test results. And as Alan alluded, 29 adults, 4 of those in ICU, 6 kids, 3 of those in ICU, and then we had 7 other adults that were considered convalescing. I just want to make sure everybody has the same numbers. All right, we're going to wrap it up here. Any other questions?
Yeah. So, I asked previously if other health institutions like long-term care facilities could have the opportunity to do the same policy that you guys are doing. Are you hoping that UMMC inspires other health organizations and providers to follow this path and protect their patients in this way?
Absolutely. I do hope, we, along the way, we have kind of stepped out there in a number of times and been the first and tried to be a leader, as we feel like is our responsibility and our role. And I hope that that applies to this situation. I hope that other hospitals and health systems that perhaps have been considering this will see that we have broken the ice and decide that it's the right thing to do for their facility as well. I would not name names, but just we've had conversations with some across the state just to let them know that we were way down the line in thinking about this and planning this, and we have had responses such as, I'm glad. We're thinking about it too, and wouldn't it be great if multiple ones of us are kind of on the same page? So I can't predict what they're going to do, but I do hope that us getting out there and breaking the ice, not that we're really breaking the ice. I mean, this has happened all across the country, as Dr. Jones said, but for Mississippi, we're the first hospital health system to make this decision and to act on it. I hope that others will indeed follow.
All right, wrap it up. Anybody else?
This policy is today.
We announced the policy yesterday. It will take effect Monday, July 26th. And then there's phases of compliance. So by November 1st, everyone should have worked through one of those phases.
Or earlier.
Or
They
earlier.
don't have to
Yeah,
wait.
they don't have to wait.
Yeah.